Hi, I'm Dr. Jonathon Daniel. I'm one of the board-certified neurologists and neurosurgeons here at CARE. Wanted to introduce you to a cool case that we saw recently and a cool surgery that I did. The patient's name is Minnie. She's a little Cavalier King Charles Spaniel who got diagnosed with a condition called Chiari-like malformation and syringomyelia. The following video will walk your way through this case as well as have some images from surgery. So if you are queasy, I advise watching at your own caution. Let me introduce you to Minnie. She is a 9-year-old Cavalier King Charles Spaniel that presented to our neurology service for suspicion of Chiari-like malformation, which we confirmed with MRI. Here you see Minnie under anesthesia with our wonderful neurology technicians and our anesthesiologist getting her ready for surgery. They have her deep asleep and they have her shaved the back of her skull and are prepping it sterilely for surgery. Here I come in to the operating room, and if any of you have ever scrubbed into a surgery, you always have to have a dancing partner to get you into your surgical gown. So here's a look at Minnie's surgery. She has her head flexed, and I have dissected down through some of the muscles at the back of the skull. And I found the back of the skull. In Chiari-like malformation, the back of the dog's skull is flattened and causes compression at the back of the brain and altered spinal fluid flow out the brain into the spinal cord, which can lead to a condition called syringomyelia, which can be painful, cause incoordination, and phantom scratching. We use this surgery to remove the back part of the skull and then dissect down through the protective layer of the brain, the meninges, which you can see me doing here with a little bent needle and some very fine dulled instruments to open the meninges up, drain some of the excess spinal fluid that's collected there, and relieve the pressure on the back of the brain. If you look very closely here, you can kind of see a worm-like appearance, and that's the very back of her cerebellum, which is at the very back of her brain. That lets us know that we have adequately expanded the back of the skull and taken away enough bone to help relieve that compression. And we're a very busy neurology service, so you can peek into the OR next to me, and there's Dr. Faber, one of our other wonderful neurologists, doing a hemilaminectomy on one of our other patients on the service that day. Here we are, surgery is done. Minnie's awake from anesthesia now. You can see she has a very special shave job, but her incision's at the very back of her skull. And then this is Minnie the day after surgery. I'm testing if she knows where her feet are in space, how her reflexes are doing. She is recently removed from some of her pain medications after surgery, but overall she's doing really well, pretty happy, and had a very good neurologic exam the day after surgery. Here's Minnie back at her 2-week recheck. We're here to see how she's doing neurologically as well as check her incision. You can see on the very back of her skull, she has a really nice straight scar that's healing really beautifully, and her hair's even starting to grow back too. Here's one of our wonderful neurotechnicians interacting with Minnie. She's going to be getting her vitals here, listening to her heart, making sure that overall she's feeling well before we even do our follow-up neurologic exam. And here's Minnie strutting her stuff 2 weeks after surgery and coming out of strict kennel confinement, giving her time to recover. She's walking really well. Her mild ataxia or incoordination has almost all resolved, and she was very comfortable on her examination. So we're ecstatic with how Minnie has done recovering from surgery.
This is their favorite part post-op, is when they come here and get all the good scratchies that they can't reach.
And here we are taking Minnie back to her parents after she aced her follow-up neurologic examination. Minnie did great for her exam. She's been doing well ever since. She went back home, cleared to return to normal levels of activity and to enjoy life as she previously had.